Hello friends, welcome to Shri Netralaya. In this video, we will be showing a case of mature cataract and we will be managing this case with ultrasonic pre-chopper and a newly developed instrument called Nucleus Sustainer to manage the nucleus while ultrasonic pre-chopping. A main port incision with 2.6 mm is taken and I have taken only half of it, and a side port entry of 23 gauge is taken. Trypan blue is used to stain the anterior capsule and it is washed away after 30 seconds after staining of anterior capsule with saline. Visco is injected into the anterior chamber and anterior chamber is well formed, and make sure the eyeball is firmly formed. I have used a 5.5 mm rhexis marker to have better orientation of circular continuous rhexis. These are the cases where rhexis is extremely important and give a meticulous time and each step plan accordingly so that you get a proper circular continuous rhexis. A firm eyeball and a firm anterior chamber is a key to success. To start, you can use a cystitome and then continue with the same in a circular fashion and complete the rhexis. Either way, you can use a rhexis forceps for the same purpose. I have extended my main port incision to 2.65 mm here. Now, to debulk the anterior chamber and the nuclear material along with some amount of cortical material so that I get more space in the bag to have further manipulations easy to have a good ultrasonic pre-chopper. Cortical material is taken out, nucleus is well rotating, and with this more space I can manipulate my ultrasonic pre-chopper very well and the Nucleus Sustainer instrument also. So once this debulking of the nucleus is completed, anterior chamber again is formed with viscoelastic. This is the instrument which I have developed. The tip is blunt. The inner edge of this instrument is a cutting edge and it is a very thin tip instrument so that it goes comfortably in the bag, and as the tip is blunt it cannot damage the posterior capsule. Left hand instrumentation is a crucial instrument in managing cases with pre-chopper, that is maybe a mechanical pre-chop or a ultrasonic pre-chop. This particular instrument is having sharp inner edge that helps in the cutting of nucleus into two pieces, and the blunt tip do not damage the posterior capsule. So you can utilize this particular instrument. Here I am using a AMOS ovarian compact machine with ultrasonic pre-chopper attached to the phaco handpiece. I have entered to the equator with left hand, and with right hand I am cutting the center of the nucleus. You should have enough depth to enter and then separate the pieces comfortably. You can see how comfortably it can divide the very hard nuclei. Note how in a fashion of making it horizontal and entering into the equatorial area I am managing it. These movements are very important because otherwise you may damage the rhexis margin or otherwise a bag. The second cut is done. Now the second piece is further divided into two pieces, and that completes the division of nucleus into 4 pieces. Now to manage further, we can go ahead with a routine phacoemulsification probe and finish off the case very easily. Ultrasonic pre-chopper is a very powerful tool, especially in situation where you have a very hard cataracts to manage. Now a routine phacoemulsification procedure started. See how nicely each piece can be taken out and further divided so that the nucleus division becomes easy and the total amount of ultrasonic energy power delivered into the anterior chamber decreases by a lot. The ultrasonic tip which we use is a very thin instrument. So there, if you use more amount of ultrasonic power or foot pedal in a continuous position also, it do not cause damage to the surrounding structures and safe for endothelium. Now while taking out the last piece, be careful that your chamber is well formed. Divide the last piece into further two pieces and finish off each piece in a very slow manner with cool head. Make sure your chamber is well formed. To prevent any PC rupture, take your left hand first out and then the right hand out. Anterior chamber is again formed with viscoelastic, followed by irrigation aspiration step, which I usually use a coaxial IA handpiece. Alternatively, you can use a bimanual handpieces also. Cortical material is taken out. Anterior capsule is slightly polished with the help of coaxial IA probe. AC is formed with viscoelastic and a foldable intraocular lens is injected into the bag. The left hand can dial it into the bag directly without increasing the steps further, and visco is washed off from anterior chamber and from below the lens and thereby completes the surgery. Hope you have enjoyed this case. Do subscribe to our YouTube channel Dr. PANKAJ LANDE for more such exciting videos. Good day and thank you.